and firstly I want to thank the County Coroner's Office for giving me the opportunity to raise this issue this afternoon. Minister, as you know, the mental health services in Tipperary were devastated in 2012 following the closure by the then Minister Kathleen Lynch of St Michael's inpatient unit at South Tipperary General Hospital in Clonmel. That decision left Tipperary North and South with a mental health service which is not fit for purpose. And it's important to note that all stakeholders at the time, staff including medical and nursing staff, patients, GPs and the public, were opposed to that closure. The closure meant, of course, that South Tipperary patients had to travel to Kilkenny for inpatient treatment, North Tipperary patients to Ennis for treatment. And these units themselves were not fit for purpose. And to confirm that, we have simply to look at various HICWA reports and indeed a prosecution and a conviction in the case of the Kilkenny unit. The units were overcrowded, leading to late admissions for Tipperary patients and early discharges, and serious difficulties for family and friends supporting patients from the point of view of transport. Outpatient services as well, where community-based teams in particular were understaffed and underfunded. And they did not and still do not comply with the Vision for Change standards and staffing levels. Minister, I want to acknowledge that you have accepted that the closure of St Michael's unit was wrong and shouldn't have happened, and indeed I want to acknowledge the work being done by you, Minister, by representatives of the Save Our Acute Hospital Services Committee and Oireachtas members from Tipperary, with a view to reinstating inpatient beds in the county, and I hope that that work will come to fruition soon. But Minister, a specific promise made at the time of the closure was that there would be the construction of a purpose-built crisis house at Clonmel. Now, this is 7 years later, and the public, patients and indeed staff see little or no progress in relation to it. So I'm asking you today to clarify the position regarding the construction of this unit, and I want to ask you a number of questions which might help us to see exactly where this project is at. If you could set out the timescale for the construction of the crisis house, confirm that funding has been approved and is in place, and indeed that the funding and the project will not be affected by the overrun on the National Children's Hospital. And is there formal approval to go to tender? And if so, when is it envisaged that the project will go to tender? And when is it envisaged that construction will commence? And is there a completion date for the completion of the construction of this unit? Minister, the construction of a purpose-built crisis house is urgently required, and I'm asking you here today to confirm that it will be dealt with as a matter of urgency, and that progress will be made in the tendering and the commencement of the unit. Thank you.
Gormagot Lascan Corla and Arish Gormagot Asocht how Arawan Sonov as well. Thank you for choosing it today, and thank you, Deputy, for raising the issue. And can I just at the outset, I have said on this floor before that one of the most admirable characteristics of any deputy in the House, or senator indeed, is consistency. And I just want to acknowledge Deputy Healy's consistency and thank him for his continuing interest in all areas related to mental health in the area that he represents in Tipperary. And I want to acknowledge that he has continually raised and challenged this, and for the good work he has done on behalf of mental health and promoting it, awareness of it in his local area. Specifically on the issue of the crisis house in Clonmel, and as the Deputy is aware, I have quite familiar with the project and have met with him and his colleagues on a number of occasions, and have visited the area and met with him there as well to view the services that are available and to see how we can progress this. I am very, very anxious to see the crisis house in Clonmel developed as soon as possible. What has happened, and I think the Deputy will be aware of some of this from our meetings, that there is new building regulations since it was designed, and you said yourself it was going back 7 years. There's new building regulations have to be taken into account, so that has been done. So at the moment, where it is exactly at the moment is that we are recosting the project because they have been, a detailed design has taken place, a detailed redesign, if you like, accommodating the new building regulations. So therefore we had to recost the project, and that's being done at the moment. And I'm very anxious to see it included in the capital development plan, which will be launched very shortly by my colleague, Minister Harris. And there is nothing to stop it progressing from there. I have, as the Deputy alluded to there, been down in the area, and I have acknowledged that there is an issue with accommodation and with beds in the greater Tipperary area. And I see this as an absolute priority on a national front, and I don't say that lightly. There's people in every constituency looking for something to be done in their area, but I have no difficulty whatsoever in saying that I would like to see the crisis house in Tipperary top of the list of projects coming under the mental health area and seeing it addressed, because there is an issue there. Obviously, the Deputy will also know that my own philosophy very much as well is to build a level of infrastructure at a lower level, if you like, and I don't like using the word lower, but a reduced or a lower level of infrastructure for mental health. And thankfully the Jigsaw service is now going to be rolled out in Tipperary, which I know the Deputy has publicly welcomed before, and we need to see more investment in that level of infrastructure so that we can prevent the need for people having to access psychiatric beds. When we look back in this country's history and we look in the 60s, there was 20,000 psychiatric inpatient beds in this country, and all of them filled. Today there's less than 1,000, so we've come a long, long way in how we deal with the challenges presented by people with their mental health. And I have tried, in the 2 years I'm in this job, very much to refocus and reorientate the system towards more proactive, bottom-up supports, earlier intervention, to prevent people having episodes of psychosis and such like that are meaning that sometimes they have to go into care. But at the moment we also have an issue to deal with the people who are presenting with acute mental health issues, and I do accept the challenges that are there in accommodation and having to go to Kilkenny. So I am really anxious to see this project progress as soon as the recasting, which I don't see any delay with. I don't see any problem with having the funding available for it. This has been a top priority nationally, and thanks to the good work of you and your colleagues has ensured that it remains so. I think the people in the HSE are very, very aware of my concerns and of your concerns and your colleagues' concerns, Deputy, regarding this project, and our anxiety to see it proceed as quickly as possible. And I certainly will do everything I can for my part to ensure that this crisis house is built in Clonmel without delay.
Thank you, Les Corlin. I want to welcome the Minister's reply and to thank him for the detail of it, and particularly to welcome the fact that he believes that this project is a priority issue for mental health services in Tipperary. And just to say that the existing crisis house is not fit for purpose. It's an old building, and it's particularly not fit for purpose having regard to modern psychiatry and modern standards. And certainly the building of a purpose-built unit for the crisis house is obviously necessary and is obviously an urgent priority as well. I just want to take this opportunity also to welcome the Jigsaw project, which the Minister has mentioned, and it certainly is something that we've been looking for quite some time in Tipperary, and has been welcomed widely across the county. I also want to briefly acknowledge the work of the staff working in mental health services right across Tipperary, and they work above and beyond the call of duty. And I suppose it's also important to recognise the work of very, very many voluntary organisations right across Tipperary who are working in the field of mental health. I welcome the Minister's reply and hope that we can see JCBs on the site in the not too distant future. Thank you.
Yeah, just in conclusion, I think I've said what I have to say regarding the specifics of the project. I wholeheartedly endorse this as a priority nationally, not just a priority for the county of Tipperary, but a national priority. I have no difficulty whatsoever standing over that, and determined to see it being developed and being delivered for the people of Tipperary. We'll continue the work we're doing in the other areas of mental health down in the county, and just to again thank the Deputy and his colleagues who have continued to keep a keen focus on the area of mental health in the county of Tipperary. And I think a lot of your continuing efforts have resulted in decisions like Jigsaw, opening up in the area. So I look forward to the next phase of mental health development of the services there. And just to concur with the Deputy as well, the staff that deliver the services, oftentimes people can be very quick to do down the services in mental health and say they're non-existent or don't exist or that they're not there or whatever. But there's staff working very, very hard, and we will all hear the hard, tough stories which we prefer we didn't ever have to witness, or that nobody had to go through some of these extremely upsetting episodes. But also there are many, many, many children and adults availing of mental health services across the county of Tipperary on a daily basis, being delivered by exceptional staff in a very, very challenging area. So I welcome the deputies and want to concur with them to acknowledge and thank the good people of Tipperary who have been delivering mental health services across the county over the past number of months and years. So,